In India, arthritis affects more than 180 million people. And moreover, India is more likely to emerge as the capital of arthritis by 2025. Now, let us have a closer look at Eastern India, particularly Odisha. Considering the population of 4.4 crores, Odisha is expected to have around 40 lakhs people suffering from this chronic painful condition called arthritis. In spite of all the need and dedicated care arthritis and rheumatoid arthritis requires, till now we don't have any specialized center for it at Odisha. The dream is realized and Odisha's first exclusive Arthritis and Rheumatology Center, OARC, is founded at the temple city of India, Bhubaneswar. The man behind the foundation of OARC is the first ODI doctor with a specialization in clinical immunology and rheumatology from the prestigious SGPGIMS Lucknow and a gold medalist from the prestigious institution and the winner of Professor R.K. Sharma Best Clinician Award 2014. He was instrumental in introducing DM Rheumatology course in the state of Odisha. He is the founder of Odisha Arthritis and Rheumatology Foundation Trust, which is dedicated for treating economically unprivileged arthritis patients who are unable to afford for their treatment. For the love of his land and with the passion to provide dedicated care in arthritis and rheumatology, Professor Dr. Jyotiranjan Parida founded Odisha Arthritis and Rheumatology Center, OARC, which is first of its kind fully fledged center in Odisha dedicated to arthritis and rheumatology care.
Arthritis is a very neglected disease. Millions of people suffer from this crippling and painful condition called arthritis. But very sadly, we have very less number of doctors, specialized centers who deal with this problem. If today somebody is having an eye problem, is having some heart element, then they have a specific ophthalmology center or they have a specific cardiac center. But if somebody is developing joint pain or swelling, then there is a lot of confusion in our society. After I finished my super specialization degree in rheumatology and clinical immunology, when I came back to my state, I sincerely felt the need of a specialized rheumatology center.
At OARC, we understand every patient is different and needs specialized and personalized care. Let us hear from our patients about their personal experiences in OARC.
My name is Anita Das. I am Bhubaneswar. मोर बहु वर्ष आर्थराइटिस रोग बाहरी प्रथम मोर आंठू गंठी सब दरज है आस्ते आस्ते हाथ गोड़ा सब फुलिला बहुत असुविधा होता मुझे कम कर प्रथम होमियोपैथी आयुर्वेदिक सब देखली तथापि मोर कमिलानी बहुत दिन पर ठिकना पाई ज्योतिरंजन सार आठी मु वर्षे है आसूची ए वर्ष भितर मोर बहुत उन्नति होती दरज सब कमी जाइए टेस्टिंग भी चलती मेडिसिन मिलूँ तेणु गोटे जगह आसवा आम विभिन्न जगह को जाकरी विभिन्न प्रकार टेस्ट कला को बहुत असुविधा होता किंतु एठी आसवा द्वारा मोर सब काम सहज हो पार्टी शीघ्र पाई
আমি पूर्व मेदिनीपुर वेस्ट बेंगल पटाशपुर থেকে এসেছি এই আমার মেয়ে ছোট মেয়ে সুতপা তো ওকে জ্বর হয়েছিল তে ওর ওই হাতেটাতে সব ওগুলা সব গন্ডগোল হয়ে গেল সব ওগুলাতে সব হলুদ হয়ে গেল হলুদ হয়ে ওগুলা ঘা হয়ে ফোসকা হয়ে গেল জ্যোতি স্যার আমাকে খুব সহায়তা করেছেন ট্রিটমেন্ট করে ওকে সুস্থ করে নিয়ে গেলাম তারপরে বর্তমান এখন চেক আপ করছি স্যারের কাছে তো মোটামুটি ভালোই আছে, কোনো অসুবিধা হচ্ছে না।
ମୋ ନାଁ ସଞ୍ଜୁମଣି ଦାସ। ମୁଁ ରେମଣା କ୍ଷୀରଚୋରା ମନ୍ଦିର ପାଖରୁ ଆସିଛି। ମୋର ବହୁତ କଷ୍ଟ ହେଲା। ମୁଁ ବାଲେଶ୍ୱର ସାରା ବୁଲିକି ମେଡ଼ିସିନ ବହୁତ ଡାକ୍ତର ଦେଖିଲା ପରେ ମୋର ଭଲ ହେଲାନି। ମୋ ହାତ ଫୁଲି ଯାଉଥିଲା, ମୋ ଗୋଡ଼ ମୁଁ ଏରକୁ ଫୁଲି ଯାଉଥିଲା, ଚାଲି ପାରୁନଥିଲି। କିନ୍ତୁ ଏଇଠୁ 6-7 ମାସ ହେଲା ମେଡ଼ିସିନ ଖାଇଲା କତରୁ ଭଲ। ଏଠି ସବୁ ସୁବିଧା ଅଛି। ଏଠି ବ୍ଲଡ଼ ଟେଷ୍ଟ ଆଉ ସାର୍ ବି ଭଲ, ସବୁ ମେଡ଼ିସିନ ଦେଇଛନ୍ତି। ମୁଁ ସବୁ ଖାଇଲା ପରେ ମୁଁ ଭଲ ହେଇଯାଇଛି।
Arthritis patient need some special provisions. If somebody is having arthritis, the first thing is diagnosis, and for the diagnosis you need a good up-to-date medical lab where all the recent advanced tests can be done. If somebody is having arthritis, you need good rehabilitation, you need good physiotherapy. If somebody is having arthritis, you need a good center where all the latest medicines are available. And moreover, arthritis patients need compassion, they need good support staffs, they need good counseling. So keeping all these things in mind, we have came up with this idea to have a specialized rheumatology center for the first time in Odisha. Odisha Arthritis Rheumatology Center, or OARC. It's a dream. It's a concept that we have thought of to provide all the required services under one roof, so that a patient comes in the morning, steps in and find all his requirements solved in one campus, and then go back in the evening with a diagnosis and with the treatment written in his file. If you are making a center, your lab has to be 100% accurate and precise. So for that, there are some specific tests that are very, very important for treatment of these arthritis patients and patients suffering from autoimmune diseases. Besides your normal parameters like your complete blood test, liver function test, kidney function test, you need certain tests like ESR, C-reactive protein. These are the tests to monitor the progression of the patient. Sometimes we come across patients who are also having kidney involvement, liver involvement, lungs involvement, brain involvement besides their arthritis, and they are part of autoimmune systemic disease, which are called as systemic lupus erythematosus, and they are basically diagnosed based on certain autoantibody tests, which are very, very highly sophisticated tests. So at Odisha Arthritis and Rheumatology Center, we have a novel autoantibody lab called as Immunix. So Immunix stands for a lab which gives you very highly accurate and precise reports, because we believe in quality control. We do some special tests which are very, very important for diagnosing these arthritis patients and patients with autoimmune diseases. There are certain tests which are very, very important called anti-nuclear antibody test, anti-dsDNA test, complement test. So these are the tests which require special expertise, training and high quality equipments to give you the correct and precise message. So the whole aim of Immunix is to provide high quality and precise lab reports at the quickest time possible, because all the tests we do it here. So within one day we usually provide all the autoantibody and high quality tests which are required for these autoimmune diseases within one day, so that the patient diagnosis become early, fast, and accordingly we can treat and monitor the patient. So for these patients who are actually living below poverty line, it's very difficult for them to have a meal in a day after working throughout the day. We have planned a 1 rupee clinic for them, and the concept is every month we will do this clinic on the first Thursday, where only by paying 1 rupee the patient will consult us, get the all necessary treatments, so that these people who are usually not able to afford for their treatment will have a smile on their face. So many people are asking, why 1 rupee? Why it is not free? Because 1 rupee is a symbolic thing, that if the patient pays 1 rupee, then this is not a free clinic. So patient will have all the dignity for his treatment. So we are not doing it for free. We are giving that patient that dignity, that he is paying 1 rupee and showing to us, and we are also responsible enough that if we are taking 1 rupee, we should give all the care and compassion that a arthritis patient needs.
ମୁଁ ସବୁ ଲୋକଙ୍କୁ ଏତିକି ଅନୁରୋଧ କରୁଛି ଯଦି ଆପଣଙ୍କର ଆର୍ଥ୍ରାଇଟିସ୍ ବାହାରୁଛି ତାହେଲେ ଆପଣ ଓଡ଼ିଶା ଆର୍ଥ୍ରାଇଟିସ୍ ରିଉମାଟୋଲଜି ସେଣ୍ଟରକୁ ଆସନ୍ତୁ ଯେଉଁଠି ଆମେ ଏସବୁ ଜିନିଷ ସହଜରେ ପାଇପାରୁଛେ ଏବଂ ଆମ ଟ୍ରିଟମେଣ୍ଟ ମଧ୍ୟ ସହଜରେ ହେଇପାରୁଛି।
যারা অ্যারথারাইটিস বা রিমাটোলজির সমস্যা নিয়ে ভুগছেন তারা এদিক সেদিক না ঘুরে ফিরে অ্যারথারাইটিস অ্যান্ড রিমাটোলজি সেন্টারে এখানে আসুন। এখানে পরিষেবা খুব ভালো এবং স্যার খুব যত্ন সহকারে দেখেন, এখানে খুব তাড়াতাড়ি আরোগ্য পাবেন।
At OARC, our approach is to halt the disease progression to prevent further damage, heal the damage due to arthritis, so that you can tackle arthritis head on. At OARC, arthritis is treatable. Arthritis care is not just a single episode of care, it is a journey, and this journey requires a focused approach by a dedicated team of highly experienced specialists. Consult OARC today.